So I watched this documentary the other day on brucellosis.
Oh, yes. I saw that.
Yeah, it's crazy. So apparently it's this like contagious disease. It's mainly found in cattle, like, goats, cows, pigs, and swine, but it can affect people too. Like it can spread to humans. And it's a disease. It's also known as a contagious abortion or a Banks disease.
It's aggressive.
As far as transmission, I guess if the milk of this infected animal is not pasteurized, then the infection will be transmitted to a human through like milk or cheese products. It can also be transmitted through breathing in the bacteria that causes this, but this is generally found in like people who deal with like labs with the bacteria, or like slaughterhouses or like meat packing plants, that they're like exposed to it. It can also be encountered through like if there's a break in the skin, and then the bacteria is exposed to like your blood through semen or the placenta of an infected animal to enter your bloodstream, like through an open wound. In super rare cases, though, death can occur, but it's like only 2% of cases. So
yeah, and they were saying that the signs and symptoms are similar to like the flu, where you're tired, and you have a fever, and you have a headache and muscle pain and everything like that. But some symptoms actually don't even go away, I guess, after a while. Some of them can even stay. So if you almost feel like you have like arthritis, edema in the scrotum, check the scrotums. And then you can actually have like fatigue and depression and things like that. So some of the symptoms would be really actually pretty vague. So if you were not really maybe aware of this and you drank some random unpasteurized goat milk, or maybe were eating some cheeses and things like that. Was this goat milk?
Oh my god, I don't know if this is pasteurized.
Alora.
Oh no!
Goat milk.
Pasteurized.
Unacceptable.
So it was really interesting as far as like the prevalence, that, while risk factors of this brucellosis have been investigated in detail in different countries, they're really more prevalent in areas where we see like more cultural farming and practices such as that.
Yeah, we were looking up, and interesting is that the CDC, according to the CDC, only 115 cases in all of the United States were found. I think about 26 were in Texas, which maybe makes sense because maybe there's more farmlands and things like that. But actually, the next highest up was California. So strange, because I maybe would think of California as being maybe one of the highest ones. But again, over all of the United States, only 115 cases, and that was the last time that was talked about was in 2010. So it's been 8 years since any of this has happened. So yeah, again, not probably very prevalent, but has happened.
Areas such as Africa, this disease remains widely neglected, with little attention to control of prevention. So apart from South Africa, vaccination is really conducted, and if done, has been on an ad hoc basis rather than coordinated national programs. So this is kind of like out of control in other countries where they see it more prevalent than we would maybe in the United States.
So, as we already talked about, the prevalence of that is mostly going to be found in just those farming communities. But again, the populations, we're talking about populations mostly at risk, is going to be the expecting mothers, obviously dairy farmers, anybody who's going to be in contact with these livestock. So if it's slaughterhouses or anything like that. And then again, just even if you're not a farmer, but you are for some reason eating an abundance of unpasteurized milk and cheese from these animals, you're obviously, that population will be at risk. As far as where in the world this diseases are most common is the Middle East, the Mediterranean, so places like Portugal, Spain, France, Italy, Greece. Maybe when you're like, ooh, all these yummy cheeses, maybe be careful on if they're pasteurized or not. I don't know, maybe you just go over to another country and think it's going to be a good time, and then you're get some brucellosis. And I don't think I've finished. So some of the other areas, as we said, is Italy and Greece, and other places, Mexico, South and Central America, Eastern Europe, Asia, Africa, and the Caribbean.
Oh,
that's not really Caribbean. It's Mexico,
okay.
Maybe
Mexico. That's okay. As far as prevention, I think it's pretty basic, just avoid or don't consume unpasteurized milk or cheese or ice cream. Ice cream's so delicious. And then, just, people who handle animals, make sure they wear rubber gloves, goggles, a gown or an apron, and a mask to protect themselves from any of those airborne pathogens. And then as far as, how resources may affect the prevention strategies, in areas that are more impoverished or that maybe they lack proper sanitation or funding for protective gear, there's a greater population at risk in these areas. Individuals aren't able to adequately protect themselves from this pathogen because maybe they can't afford it or they just don't have access to those things. So that makes it kind of difficult. As far as prevention, I think it's pretty basic, just avoid or don't consume unpasteurized milk or cheese or ice cream. Ice cream's so delicious. And then, just, people who handle animals, make sure they wear rubber gloves, goggles, a gown or an apron, and a mask to protect themselves from any of those airborne pathogens. And then as far as, how resources may affect the prevention strategies, in areas that are more impoverished or that maybe they lack proper sanitation or funding for protective gear, there's a greater population at risk in these areas. Individuals aren't able to adequately protect themselves from this pathogen because maybe they can't afford it or they just don't have access to those things. So that makes it kind of difficult.
So when we talk about diagnosing this disease, it's talking about the surveillance protocol from WHO. What they talk about is that there's this presumptive diagnosis, and in doing that, it's the RBT test, it's the Rose-Bengal test. We want to do that for screening, and then there's also another one, it's the SAT test, not the one from high school. It's the standard agglutination test. You're going to do those two tests, and that's kind of the presumptive diagnosis. And then to do more of a confirming diagnosis, you take those two tests and you combine them with the detection of a non-agglutinating antibodies, things like the IgG test and the Combs IgG. You're going to kind of combine all those together, and that would be more of the confirming diagnosis. It also discussed through the WHO that the PCR and the new rapid tests, such as the lateral flow assay, are not necessarily accredited or confirmed. Mm-hmm. When we're talking about things, so you have your diagnosis, things as far as how does cultural or values or beliefs or political situations have these factors that are affecting the treatment. I feel like oftentimes people, maybe it's their culture, they live off of the land, they're in farming, and I don't think mostly they're really thinking of infection. I think they're just thinking about, I'm trying to survive and take care of my family. So I think that they're not necessarily thinking infection, they're thinking survival. So they might not be washing their hands, covering, maybe like using a bandana or some kind of a mask that they have.
Sure.
Yeah, some kind of a shirt or a scarf, something like that. And I think also, politically wise, I think the United States, they have so many things in place where the government will say, these are the protocols, in this environment, mm-hmm. There's certain standards of protection that you need to be having. And I just think in other countries, they don't really have that. It's kind of just a free-for-all, mm-hmm. and they don't necessarily think of things like that as far as diagnosing and treating these kinds of diseases. It's just more of, that's just the way they live. So I think a lot of times maybe it's just kind of missed and fallen by the wayside.
So as far as how the WHO and the CDC work together for surveillance and detection, according to the World Health Organization and their surveillance guidelines, the rationale for surveillance is a key element for the management and prevention of and control of all these programs to help kind of control the disease spread. And then recommendations for this type of surveillance is early case-based reporting by care providers. So what you're going to see through, maybe as an NP, and or laboratories to upper levels of public health sectors for appropriate levels of animal health sectors, because those all kind of play into each other since it's an animal-borne disease that affects humans. And then in endemic countries, where investigation of reported cases may not be feasible, a representative portion is reported cases should be investigated routinely. Sometimes, they don't have these programs set in place to help us report and kind of get adequate data on the prevalence of this disease currently in that area or that country. And then as far as case management?
Yeah, so say, like we talked about, there was those 115 cases in the United States. The majority of those, the little bulks that we were talking about, was maybe California, Texas. So say you're a California or Texas NP and you have a random, maybe some random guy who's a farmer, works in the fields, and he comes in and is, maybe presented with some of those signs and symptoms. As far as the case management, they were talking about doxycycline, how that would be one of the things that you're going to prescribe. Experience suggests that streptomycin can be substituted for gentamicin, so that's another kind of thing that you can do. Optimal treatment, they were talking about if you are a pregnant woman or a neonatal or anyone under 8, that there was it wasn't really determined on what would be the best thing, but for children who experience with
Trimethoprim.
Yeah. And sulfamethazole.
Yes.
Yeah. With any of those combined with the aminoglycosides, such as like streptomycin or gentamicin, like I said, or rifampin.
Yeah.
Rifampicin.
Yes.
Yeah. That's why we do education, not NP. No.
Okay.
But anyways, those would be the medications that you would prescribe if you randomly had saw one of those patients that presented with one of those signs and symptoms, and those tests that we already discussed came out positive. So.
And I was trying to think what exactly would be the role of the World Health Organization and the CDC.
So I think, as we already talked about, the CDC is basically, they'll just do the surveillance. They talk about how prevalent it is in a certain area, and it does discuss, it talks about your risk factors, and it talks about the people that are most, at risk. So as far as the role for the World Health is, I guess, maybe just education, and even though they don't have the resources to necessarily know. I think if you were over, say, somebody does missionary work in these other countries, maybe just bringing that information over, that this is something that would be maybe much more real to them in that situation, and that's just the way that they live, that just knowing that maybe in these other countries worldwide, just giving them that education that they need to be aware of these things.
Okay.
Then the references.
Wait. So attached to the YouTube video is our reference list. And remember, pasteurize is always best.